Denial is commonly found amongst persons with dissociative disorder. My favorite quotation from such a client is, "We are not multiple, we made it all up." When I hear it, I politely inquire, "And who is we?" A quote from Alison Miller's Healing the Unimaginable, treating ritual abuse and mind control. Though multiple personalities may seem too absurd to be real, there are extreme effects to the diagnosis, too serious to put off as nothing without a clear perspective of the causes and characteristics. We'll begin by going over the causes and what sets them apart from other diagnoses as well as the primarily affected. To begin, multiple personality disorder is caused, like many mental illness, by early childhood trauma such as severe emotional, physical, and sexual abuse. Childhood abuse is linked to dissociative identity disorder in 95 to 98% of the cases, Carroll's statistic of 2008. What sets this aspect of diagnosis apart from the other disorders is that in DID cases, abuse begins from a much younger year than the average year of 7 and is heavily repetitive for a number of years. This being so, we can clearly see how something traumatic reoccurring over a child's important years of development could take a toll on them. Also, according to Frederick Lewis's Hall MD research of 2008, females are more likely to receive a diagnosis of DID at a ratio of 9-1. Females are at a 5-1 ratio to be more likely sexually abused, while boys are at a 15-2 ratio to be more likely physically abused. Around only 10% of sexually abused children are abused by strangers. An estimated count of 60% of sexual abused children are known to the family member, but not part of the family. By this, we can conclude that the leading patient diagnosed with dissociative identity disorder is not only female, but a female who experienced repetitive sexual abuse starting around the age of 4 by someone she knows. Now that we know the causes and the people primarily affected, we'll be taking a look at the effects on these people. Dissociative identity disorder is characterized by having 2 or more distinct identities mentally, and by having gaps in one's memories caused by dissociation. Dissociation is the disruption of one's thoughts, memory, and sense of identity. Mild dissociation can be seen as daydreaming or when you get lost in a moment, when the world around you seems to not exist for your focus is deeply on something else. Dissociation is recognized in diagnosis when made clear the person's used or uses the act of dissociating themselves from experiences too painful to acknowledge conscious as a coping mechanism. The presence of 2 or more personalities means to have created alters in place mentally to deal with trauma. Alters have different identities and most have their own name as well. Their age, race, even sex may differ in the mind of the victim. There is presence of distinct speaking patterns, gestures, self-image, and sometimes handwriting. These types of characteristics dig deep into the subconscious imagination of heavily abused children. The company of alters causes blackouts while the victim is dissociating from their attack. This other identity is then left to endure the pain. Sometimes this is referred to as switching. As the abuse slowly stops, alters aren't as needed, but DID patients can and most likely will continue to use this coping mechanism in response to stress. The victim is usually left remembering the bad experience happened, but normally they forget how often it occurred due to dissociation. This being so, some use alters unknowingly in situations that bring up bad memories. Something as little as being in the same room as the attacker, depending on how violent or repetitive the attacks were, can trigger the abused to retreat via switching. Considering this, is seen that most children are abused by someone they know and have done enough to be characterized as repetitive. They are most likely to have to deal with them on a normal basis, such as at weddings, parties, or dinner. We have now seen the aspect that makes up this disorder as well as what characterizes it. Next, we'll be exploring the patient's process of rehabilitation. As they get older, the act of dissociating and the use of alters can become clear to the victim to become self-aware enough to seek answers. Experiencing an event with someone while dissociating and then later having that someone try to bring it up as if you both remember it usually ends in you denying that you were ever a part of the event. Sometimes you are even addressed as a different name, insisting that's who you said you were. As this happens more often, you would catch on. And at this time, you would realize that you might need help and/or you drive yourself crazy. Though there is no cure, depending on the patient and the severity of their disorder and attacks, and how they dealt with it up until the time of treatment determines the type of treatment. Long-term psychotherapy encourages communication. Cognitive therapy is also used, but more with patients who have let this disorder get to them, and helps render dysfunctional thoughts. Creative therapy often helps express and explore feelings and memories. on people who aren't open to communicating. According to the International Society for the Study of Trauma and Dissociation Treatment Guidelines, the first step to establishing is to establish safety and then confronting the disorder and traumatic causes. The third step is identity integration. Identity integration consists of reconnecting existing alters into one, allowing one patient to heal painful memories. Typically, the older the patient is, the harder it is to do this, so therefore the patient is put through the first and second step, but the third is changed into teaching the person resolution, to coexist and coordinate among their alternate identities and bring optimal functioning. Over the past couple minutes, I've hopefully taken you clearly in and out of the entirety that is dissociative identity disorder. We began by examining the causes of this disorder and who is most vulnerable to developing it, and we then deeply deconstructed the pure definition of what DID is and the symptoms that characterize it. Finally, we looked into the different possible treatments as to an incurable disease. Just because something is extraordinary or may seem absurd doesn't mean it doesn't deserve a chance at recognition. For a while, people screamed witches in place of seizure attacks. Everything that is said to negatively impact someone deserves examination.